It's Dr. Winters, and I want to talk with you about the chronic patient of 2026. It's way different than the chronic patient of 2019, and of course, way different than earlier in my career. But since COVID, as you know, everybody's nervous system's changed. So now we have everybody, at least with our really chronic patients, with high histamine responses. They've got rashes, they got itching, they got brain fog, they got lots of bloating after they eat. They're really sensitive to different foods, and they've been narrowing down their foods and what they react to and what they don't react to. Their energy, besides just being bad, they really have to budget it because they could only have so much energy to use for so many things. And once that's tapped out, they could be down for a day or two. And so they have to figure out if they want to do something, if they have enough energy for it, and how much it's going to cost them in the next coming days to be down because they did that. Also, their heart rate changes dramatically after changing positions. They might lie down, stand up, and their heart rate goes up by 30 beats per minute. They have POTS, or postural orthostatic hypertension syndrome. Or they get up and they get dizzy and their blood pressure drops, or their heart rate spikes in the middle of the night when it should stay calm. Lots of things are happening which don't, to the average person, don't really make sense regarding their autonomic nervous system and their heart. And they go get everything checked out and the heart is fine structurally, or the heart is fine in terms of its internal pacemakers. That's all good. It's the external nervous system that's off. Now, the other thing is these people have inflammatory type pain. They have pain that's not due to a specific injury. They have pain, they just ache and they hurt and they don't feel good and they sleep and they don't wake up rested. And this is the chronic patient of 2026. This is who we're trying to help right now. Because the nervous system changed so much in 2019 with COVID. Both we had the stress of the whole thing and being forced to do things and told to do things and everything else that was going on then, and not socializing and all that kind of thing. Plus we had the spike protein stress from actually having COVID ourselves and getting that spike protein. Then all of that damaged our autonomic nervous system. And we know now from studying how we can help that we have to take a different perspective of the autonomic nervous system. We have to look at more the polyvagal approach, which says that when we're in neurological safety, when our body feels at ease, we're going to be happy, healthy, our cranial nerves are going to work good, and that we will feel relaxed and calm and at ease. And if we're in too much of fight or flight, our heart rate's going to elevate, our muscles are going to tense, our digestion's going to shut down because we're preparing to fight or flight. And then if fight or flight's not working, we'll go into dorsal vagal, which is more of a shutdown response, more of a floppy response, more of a low energy response, more of a depression type of response. And we'll be in that state and hard to get our energy back up. And that makes a big difference in understanding how things are happening for people these days. And then when we bounce between sympathetic and dorsal vagal, we'll bounce between high heart rates and low heart rates, high blood pressure and low blood pressure, energy and no energy. Wake up with our heart pounding in the middle of the night when we should be resting and repairing. And all those kinds of things are going on when we're bouncing between sympathetic and dorsal vagal. So we started looking around and seeing how we could learn more about that, and we learned more about the polyvagal approach. And then we started doing a lot of work on the anterior of the body, especially in this diaphragm area, to release tension so that we can breathe right, and that can signal the vagus nerve right. We started working in the sternum because the heart attaches to our sternum. The heart sits in the diaphragm, and the heart attaches into the lower upper thoracic and lower cervical spine. So we started releasing areas related to the heart. And we started releasing areas related to improved vagus nerve function. Then we started learning about the inflammatory reflex. Wow, is that powerful. That's a signal from the vagus nerve sensing inflammation, sending a signal to the brain, and then the vagus nerve sends a signal back down to the immune system and releases a chemical called acetylcholine, and that literally docks into the immune cells and into the spleen, and that's to help control inflammation. So all of this work on the front of the body is super important to control inflammation. We also continued our work with the brain and helping it change its responses to stress, both stress in terms of mental emotional stress and stress in terms of the environment, like bacteria, parasites, and in this case viral infections or post-viral toxins, how we respond to that. And so that work is called QNRT. I'm a master practitioner of it, only 3 master practitioners in the world. And we continue that work and adapted it more to the post-viral world. And that's been amazing also to help reduce autoimmunity and to change how our hormonal and nervous systems signal into our immune system. And so as we calm the nervous system, we tend to calm the immune system. Calm the nervous system, we calm the immune system. And that's our basic approach. Then we started looking at things, seeing so many people had such poor cellular energy that they just couldn't generate any energy. The mitochondria or energy producing parts of the cell were like stunned. If we took this light and looked at the batteries in here, there's 4 steps, like 4 batteries in a mitochondria, and each has to go through that 4 steps to make energy. So we learned how lasers could improve that, how PEMF, pulsed electromagnetic fields, could improve that, and how nutritional support could improve that as well. And so we started working more with people's energy patterns, with their histamine responses, and most importantly with their autonomic nervous system and brain. And as we've done that, people can improve from these chronic conditions. They don't have to be this low tolerant, can't hardly eat any foods, can't hardly expend any energy, really narrowed in their ability to deal with life. People can actually start to expand and expand and expand, and over time heal up and become more the person that they want to be and have the health that they want to have. So these are some of the ways that we have adapted over the last 6 years to help people with chronic conditions, and it's just a new world in terms of chronic conditions, but we've been preparing for it. I've stopped listed over the years all the courses I've taken in functional neurology, what others call functional medicine, and so forth, to help you have a trademark hidden healthcare process that we got a trademark on. Stands for hormonal balance, immune strength, detoxification efficiency, and neurological connection. We've been doing all these different things, all the different types of chiropractic, all the different types of QNRT and brain work, all the neurofeedback, the PMF, the lasers, and we've really developed a lot of tools to help the chronic patient. I would invite you to give us a call, watch more of our videos on YouTube, watch us on Facebook, call or text our office at 270-554-214, and that's 270-554-214. We look forward to helping you. We're going to do our best to help you before I decide I don't want to work anymore, just because I'm almost retirement age. But I love what I'm doing. We're going to keep working at it right now, and I'm going to serve you well. Winner's Wellness, Chiropractic Redefined.